Stay at home, save lives was a powerful message and arguably counterproductive when it came to non-COVID conditions. Louise Gray missed her final chemo session as the country locked down.
It was a completely stressful time for me, and on top of lockdown as well, making sure that I was locked away for it all, and I couldn't really speak to anyone about that because everyone was all up in the air. But I did have the support of my click sergeant support workers that were constantly giving me advice.
Healthcare professionals have been concerned that stay at home was too powerful.
I think sometimes people have maybe taken that a little bit too far and maybe not have gone to their GP when they really should have.
Although things are improving, the latest figures for England are still way down. In July, urgent cancer referrals were reduced by 19% year on year. Meanwhile, urgent breast cancer referrals were down by 34%. But more than 8,000 patients were referred to cancer radiotherapy treatments in July, compared to a low of 6,500 in April, meaning they're back to their pre-COVID levels. Waiting lists for routine operations are at an all-time high since records began. So could more public-private partnership be the key? It is controversial, but the private Rutherford Health Group says it makes economic sense for the NHS.
Well, I see COVID as a catalyst for change, and we have to change, because if you always do what you've always done, you'll always get what you've always got. Right now, that's some of the worst cancer survivorship rates in developed Europe. That has to change.
The good news for Louise is she's now in remission, but she's concerned for people who are not getting checked out.
There's such a higher chance of worrying consequences from that, basically, and I'm just grateful that I found everything that was going on with me when I did, and there was no pandemic and everything, because even that was terrifying. So I can't imagine what people would be going through right now.
While the world has focused on COVID, the other killers have not gone away, and experts say the time for checkups is now. Simon Viger, 5 News.